Yeah, many people are doing telehealth visits these days with their healthcare professionals. So today, what you should be thinking about if you're seeking help from a teletherapist.
Dr. Melissa Westendorf is the founder of the Technology Wellness Center. She joins us with things to consider when you're visiting a counselor virtually. And here's the deal. I think everybody likes that face-to-face visit, especially if you're getting something personal like counseling and therapy. But I would imagine all therapists, right, are having to switch to this new way of interacting with clients and patients.
Yeah, absolutely. We've sort of all been thrown into it and said, okay, here, now you need to do this because we want to continue to help people. And actually now people are really struggling with some anxiety and to help them through this. So we've all been sort of pushed into it, but there's a right way to do it.
Okay, I think that's good to know that there's a right way to do it. Is there research behind it? Because I'm sure as a doctor, you know that there's probably research about a right or a wrong way or ways that are more effective than others.
Right. So there is good research in case people think, well, it's not going to be as effective. Actually, there is really good research that shows it can be just as effective in person. Now, you may not like it via video, but if you don't mind it, it can be just as beneficial, which I think is, helpful for people to know that this can be another way to do therapy.
Well, and that's important to know. I know you're a psychologist. The thing is, I don't think it's any cheaper when you do it virtually as opposed to doing it in person. So, I mean, and I'm kind of making a joke, but it's good to know that the benefits for us when we receive counseling like that are just as good as in person. So talk, if you would, about the different types of teletherapy.
Right. So there's really two out there, and these are the words that are important. One is synchronous and one is asynchronous. So the asynchronous is almost like texting therapy. So one person will send a message and then the therapist will respond, whether it's a minute later, 2 hours later. And so there are some websites that do that kind of therapy. And I'm not necessarily advocating for that, but that is one way. And then there's synchronous, which is just like what we're doing today, via Zoom video or one of the websites that are out there that provide therapists with the option of doing video conferencing.
What should you look for when you decide on a teletherapist? Because I think oftentimes when I've used therapy, I've liked the energy between someone when I meet them. You have a feeling. Do you get that kind of feeling, or what should you specifically look for?
So, I mean, the first thing is when you're looking up a therapist, they need to specialize in whatever your need might be. So that's always going to be primary, whether you're in person or doing teletherapy. But the other thing is that really it's my responsibility as a psychologist or mental health therapist to maintain people's privacy and confidentiality. And so that means I have to consider encryption in terms of if it's a website or Zoom or whatever we're using, that we meet the best practice standards, right? It has to be HIPAA compliant because we don't want Zoom bombers, right? Like that's been happening lately. We don't want that happening in a therapy session. And so you need to look for on the therapist website, are they using a HIPAA compliant service? Are they, one is your insurance going to cover it? Now, in this time, it's actually insurance has come along, especially the federal insurance has come along and paying for it. But then the other thing is, do they give you an informed consent? Meaning, does your therapist give you an informed consent that talks about all the what they're using, the encryption, the software, how they're maintaining your privacy and confidentiality?
In terms of informed consent, I wonder about it as it relates to children. So parents, if your child is having therapy, would sign something for their child. And can children get teletherapy now too?
Oh, yeah, absolutely. There are sites that are dedicated to work with kids, some adolescents, and so they have therapists who focus more on adolescent issues. It's a little different. Play therapy is involved with children a lot of times, and that's harder to do via the video. But certainly that's when therapists might get the parents enlisted during the play therapy and observe it. So there are ways to work around it to do teletherapy, at least to get through these times and any future times we may have that are similar to this.
I think that was a great outline.
It.
Yeah, really good information for us to start with. Thank you so much for joining us, Doctor.
Thank you.
And to learn more about Dr. Westendorf, the Technology Wellness Center, or rewatch this segment, you can visit our website, themorningblend.com.